Good evening, everyone. This is Meldita, and I'm back here at my YouTube channel, MELDITA'S Info Corner. And this is my Facebook, joeregacho@yahoo.ca. Okay, I will present soon my kidney transplant, but this time let's take an ECG break. Okay, we have a case here. A 47-year-old male patient came in to emerge complaining of 2-week palpitation and dizziness. Okay. So there's history of 1 pack per day smoking and a little bit use of illicit drug, but he said he stopped using it already. Okay, so in emerge, they usually do ECG 12 leads, they do blood works, they do x-ray. That's part of the admission. Okay, so when the ECG 12 leads was done, this is what we saw. We have wide complex tachycardia. Okay, so if you have suspicion of maybe this is VTACH, you have to read it from V1 to V6. Okay, the question is this VTACH or this is SVT with right bundle branch block? Okay, so let's take a look. Let's go back to the VTACH parameters. And in fact, in the I think months ago, I discussed already VTACH, but this is just a review. So let's find it out. So assuming this could be VTACH, let's take a look. Okay, is it wide complex? Yes, we have a wide complex tachycardia. And wide complex tachycardia defined in VTACH says it could be 3 or more PVCs consecutively. But for us, it's continuous wide complex tachycardia. And let's take a look at the QRSs. Are they wide? More than 0.012? Yes, they are wide. In fact, they are like 0.016. So it's wide for the QRSs. Okay, and the rate. The rate says for VTACH, it should be 110 to 250 beats per minute. But we have a rate of 187 beats per minute. Okay, is it sustained or non-sustained? Well, it is sustained because this wide complex tachycardia is lasting more than 30 seconds. Okay, symptomatic or not? Well, it is symptomatic because his main complaints is palpitation with dizziness, and that's been ongoing for 2 weeks. Okay, now, so we have here a wide complex tachycardia with pulse. The patient is conscious. Okay, did you see any fusion beat? There's none. Are there capture beats? There's none. Is there concordance? There's none, because in V1 it is upright, and V2 to V6 they're all negatively deflected. There is AV dissociation, and let's find it out. Are we dealing with SVT with bundle branch block, or is it VTACH? Let's go to the parameters for the SVT, because the V1 is upright. In reading for this bundle branch pattern, we have to take V1 to V6. But if they are concordant, you don't have to worry, because if it is concordant, then it's understood it's VTACH. But this one is not, because as I said, V1 is upright and V2 to V6 are all negatively deflected upward. Let's take a look. Okay, so we have here SVT with right bundle branch block. So SVT with right bundle branch block, you have here an RSR. Okay, and in V6 you have QRS. In VTACH we have here, it could be R, it could be RS, or it could be QR. But in V6 you have here an RS. So do we have this parameter downward? Is it this one or is it this one? Let's take a look. Well, it looks more this one. It's more like this. We have here a QR. So we have here a QR. So that's QR. Okay, it's pointing more to VTACH. So it's QR. Let's take a look at V6. So the V6 here, we have here a negatively deflected QRS in here. And you see, we have here an upright, and we have here RS. So that R is a little bit pointed upward, and there is an S downward. Okay, so we see that we have here a QS, so it's not R is R. We have here a QS. And if you look at the V6, it's not QRS, but we have here an RS. So we have here an RS. So we have here VTACH with pulse. Okay, so The patient then is managed with the following medications. So they, first, before anything else, the lights came back, the potassium is okay, magnesium is okay, and they're now starting to manage with medications. So they started amiodarone. Bolus and infusion is started, and amiodarone is a class 3 antiarrhythmic drug. It's not effective. Then they tried metoprolol, and metoprolol is a class 2 antiarrhythmic drug, still not effective. Then they tried diltiazem, which is a class 4 antiarrhythmic drug, is still not effective. So they tried procainamide, which is a class 1A antiarrhythmic drug, and it looks like it worked. So soon, the patient's rhythm came back, which is baseline sinus brady at 40 beats per minute. The blood pressure is okay. So all records show that the patient has sinus brady. That's been his usual ECG, but the blood pressure is okay. So the patient is being worked up in CCU, and they did several workup like cardiac MRI, things like that. And the plan for this patient is VTACH ablation. So the procainamide infusion continues and still waiting for VTACH ablation. Now, if you ask me this question, what if VTACH ablation will be okay at first, then soon fails? Well, the patient needs ICD. Okay? So hopefully this will help you a little bit, and we will proceed with the next VTACH. Thank you.